get started because we're really excited to have you guys here. I'm Dr. Jessica Knape. I'm an internist here in Boulder. I'm super thrilled to be here with my colleague and collaborator, Dr. Ilene Rusk, who's been a real pioneer and a great support for people with brain health. Today, we are going to talk about brain health, cognitive longevity, and what we can do to actually help before decline shows up. But if there is decline already ongoing, we can also figure out ways to optimize brain health. Dr. Ilene, do you want to just give a little bit of background on you and your work?
I would love to. My name's Dr. Ilene Naomi. My last name is Rusk. I see some of my familiar faces, people who I know here, and I'm happy to see new people as well. I've been working in the field of treating and trying to reverse cognitive decline for over 35 years. I started as a neuroscientist. I'm a published author. I've worked with Dr. Bredesen for about 11 years, 12 years, since his first paper came out in 2014. I saw his first patients. And to tell you the truth, I'm delighted to be with collaborating to support you all in improving your brain health and preventing dementia and treating it. Because we're looking, so I have an integrative brain health clinic, as many of you know, here in Boulder, Colorado, and Dr. Jess and I are right next door to each other.
Great. I think it's really incredible that you've been in the field of memory and dementia for the majority of your career, and you've really seen so much change and evolve within the field. And what I'm really excited about is that the science is really coming along, and now there is more proof that working on lifestyle, reversing metabolic dysfunction, toxicity, working in community, all of these things can be very protective to the brain. So, one of the reasons we're so thrilled to bring this content is because there is a study that's about to be released in a couple of months with all of these great tips, and we want to help people to integrate them into their lives. So, this is really a labor of love, and we're just really thrilled to share this information.
Great. And the key shift has been really with Dr. Bredesen's pioneering work with his paper in 2014 that he published originally, showing that you could actually reverse cognitive decline. And Dr. Knape talked about how this work is grounded in science, and that's really what makes us so excited. And the key article that she's talking about now, the EVANTHEA trial, showed that when we address several of cognitive decline at the same time in a very precise and personalized way, then we can actually improve or stabilize cognitive decline. We can even prevent it by addressing some of those drivers. And those drivers include things like sleep, nutrition, building stress resilience, improving social connection, working on not taking away toxins from the environment, but also removing toxins from our bodies as well, tending to our immune systems, getting rid of old infections, because the brain really responds to personalized system-based care, systematic care as well. Right, Dr. Knape?
Well, yes, and it really aligns with what we see clinically. Dr. Rusk and I have been really fortunate to share patients so we can see the impact of these targeted interventions. And it's so encouraging, it's so inspirational, and it's really a new message of hope that we're really pleased to share. So I've also worked with Dr. Bredesen and some of these other pioneers. I feel that I'm standing on the shoulders of giants here, including Dr. Ilene Rusk's shoulders. Too. We really, I think it's so wonderful to have both a neuropsychologist and a medical doctor. I think that's kind of a rare combo. So this is part of our enthusiasm for bringing this information. And what we've found is that the brain is not broken, but it does respond to the environment Hormones play a big role, and it's not just one single issue. We have to cast a wide net. We really have to look very closely at all of the factors that contribute, like Dr. Ilene said. And so this is really the basis and the foundation of this course that we're presenting, which is BrainSpan Bootcamp. We're really wanting to translate the science into practical, easy to incorporate ways to optimize brain health.
That's right. And optimizing is vital. Being specific about the drivers of cognitive decline is crucial. And the magic and majesty that Dr. Jessica brings is she is implementing a wonderful organizing system in her practice that I have the pleasure of benefiting from called True Neura. And so we're doing some very esoteric work, and I want to thank Dr. Jess for being as intelligent and just for offering this type of a groundbreaking program. I'm speaking of True Neura. And do you want to get into the questions? We had a few questions that came in advance from our listeners on Instagram and Facebook. I wonder, do you want to start with the first question?
Yeah, let's dive right in.
Let's take a dive in. Okay, great. So the first question, I think many of you might have this on your mind as well, is what is BrainSpan Bootcamp anyways, and who's it for? BrainSpan Bootcamp is going to be a 6-session educational health course, specifically brain health course, designed for adults. And we say midlife, but that's a very wide range. We're very interested in working with people who do not have cognitive decline because we know that some of this, hidden markers, latent markers are still around in your body, even if you don't have cognitive decline. And some of those markers are present in blood work or in brain imaging workups. So we want to be proactive. That's the key. We want to be very proactive about brain health. So this would include people who are worried about having memory problems. I have many patients who come to me who say, I had a family member who had dementia, or I know I have 2 copies of ApoE4 and they're worried. Maybe you have brain fog post-COVID. Maybe you have emotional challenges or ADD, ADHD. So it could be for any of those reasons, wanting to optimize your brain function or just wanting to know how your brain works and feel more empowered so you could share it with family members. So again, our program is really about a salutogenic model, a health-focused model, so you feel more empowered with clarity and with agency.
Yes, and also I think that something that has been missing is empowerment around this issue, very much community as well. And we'll go into that a little bit more about the community aspects. But something I think that a lot of people come to us with is a great deal of fear. Fear about their decline, fear about, maybe going through what their loved one did, or worrying about what'll happen to their loved one when they, need more care. So there's a lot of fear. And so this is, definitely something we want to help with, is to provide resources and also to really help the nervous system to relax around the concept of health too. So that's the intention, is to have a lot of fun and to have community and to really have the intention to help the brain for the long term. Okay, so question number 2. So this person says, why do you say that Alzheimer's is a disease of midlife? That kind of goes against traditional thinking. We usually think about Alzheimer's being a disease of the elderly. But what we're talking about is that a lot of the patterns and the metabolic processes that lead to the degeneration that is Alzheimer's disease, that gets set in motion usually in the midlife, and sometimes early, of course. Younger people are having brain issues as well. And a lot of that is similar drivers to elders. But we believe that really targeting this middle part of life is the big impact. This is where the money is for all of us. This is how we can save money. This is how we can be productive in society and how we can enjoy our lives more is by taking the time before we need memory care to set the pieces in place for more cognitive longevity. So the thing is that midlife is actually a pretty stressful time. A lot of people in midlife are caring for their kids, they're caring for their parents. The whole society is at a heightened state of stress right now, and that is very toxic to the brain. Another issue with midlife are the hormonal changes that happen. And so that's very critical and something that more understanding is coming to light now about how the brain really relies on the whole neuroendocrine system. And so it's not just estrogen and testosterone and progesterone, although those are critically important. It's also DHEA, pregnenolone, cortisol, thyroid. And this is a really complex and elegant symphony of hormones. And if any one is missing, that can have impact on brain health.
That's right. And I'm so happy that you said that because you're really talking about some very specific and personalized things, Dr. Jess. And our invitation to you is we want to be changing any of those modifiable factors for you. And you can enter this program from any point with from any type of like personal direction, with any type of curiosity. You can benefit at many different levels. You can enter the brain health world because I have many people who say, well, I really don't have much money for that deep dive. What can we do? What else can we do? And so there's so many ways to enter our program clinically, but also the boot camp gives you a sense of all of the different entry points that you can have, which I think is very, very important. And I think that that's question 3 that came from one of our listeners was what makes BrainSpan different from other brain health programs? Well, first of all, most programs focus on one thing. And if you're online and you're looking at Instagram and brain health specifically, you'll notice that there are a lot of hacks. And I have patients who I completely love who've come to me from other states and they have every hack. They have all of the tools, the fancy tools, the red light, photobiomodulation, um, hyperbaric oxygen, but they haven't taken care of some of the basics. So I think what makes us different, again, is that you can enter at any point, and this isn't just about a game or 3 supplements, but we have a multi-dimensional, very personalized approach. And as Dr. Jessica said, we really care. So this is also about community building. We're looking to build supportive and caring community here because so many of us don't have that kind of place where they can be vulnerable, where they can ask questions, where they can have trepidation. And so building that community also is what makes BrainSpan Bootcamp different.
Yeah, I'm just answering a couple little questions in the chat. So I
Great.
put those there. They're pretty basic there. So I'll go ahead and go to question number 4 that we have. So this is the question, what are the 8 pillars? So our content is based on the pillars of brain health. These are foundational that you wouldn't want to miss any one of these because without focusing on sleep, for instance, we're really not going to have the same impact that we would if we did. So we have 8 pillars, and the way that we're arranging this is we're going to have 6 of them be the topic of our lectures and our group sessions, and 2 of them we're going to weave throughout the whole course. 4 brain pillars that I'll just mention now. The first one is rest, and that's sleep, but then also how we relax. nourish, and that's how we feed ourselves. There's, really great evidence that nutrition is really vital for brain health and certain, approaches that we'll make sure to cover include ketogenic diet, keto flex 12-3, but also, more basic sort of options like the mind diet. The next pillar is move, and very, very important to brain health is exercise and blood flow. So muscle health relates to brain health too, and so that's something that you wouldn't want to miss. The other really important factor is once we get all of the stage and everything healthy for the brain, we want to encourage new growth, new learning. And that's to help build new brain connections and to strengthen skills. But really doing brain training is really, it can be fun, but it definitely has a big bang for the buck. So we'll focus on that too.
That's great. And again, it's personalizing the brain training. We have online computerized programs that are very science driven, but our focus for you all is going to be let's help you find things in your own world that are really stimulating, things that you're curious about, and will personalize ways for you to grow in those areas in your neuroplasticity. So Dr. Jess just talked about four, and I'm going to share some others with you. Another one is to remove those things in our environment that are toxic and present problems for our immune system and for inflammation. So that's the remove pillar. Another one that's those of you who know me, and I know some of you are in my clinic, are to build stress resilience and nervous system health, nervous system flexibility, so that we become more aware of those stressors that are toxic for us and physiologically and also emotionally, and to be aware of those toxins that we can work with and remove in our environments, but also our external environment directly relates to our internal environment. And, just as an example, our gastrointestinal system is continuous with our external environment. I found it very interesting to learn that the microbiome in our bellies very much reflects the microbiome of our family. We kind of share a microbiome. So, anyways, yes, building resilience, connection is another one, social engagement, and our ability to do that in a lovely brain health community will be especially, I think, delightful. Reflection, and that means why are we doing what we're doing? And in a way, that's kind of pivotal. What's pivotal, as Dr. Jess said, is to weave through the connection and the reflection that this is an effort for our own transformation so that we find more freedom and we find more joy as we go through these brain health pillars. That's another thing that makes this program very unique. I'm personally dedicated, and I know Dr. Jess is too, but my practice is really dedicated in part to building stress resilience, self-awareness, and nervous system health for joy, right? That's why we're here. I went on a little bit, but Dr.
Um,
Jess,
Great. That was awesome. And Brenda asked if her husband's signing up, and she's wondering if she can attend with him to help him. And that is awesome and ideal. It really helps to have a dyad or a team, so a group to work, at home. And a lot of our patients do have cognitive challenges. It's hard to get onto Zooms. It's hard to come into clinics. So we have the most success with our patients when they have a supportive partner. So I think, and Ilene and I, Dr. Ilene, we can talk about it, but maybe there's a way we can have either a reduced rate or some kind of option
sure.
for
Oh,
caregivers.
oh,
Um,
sure.
so yeah. Okay, so another question from before. Why is community such a big focus? And so this is really relevant. And I noticed this when I was working in skilled nursing and memory care during COVID. We had a huge decline during that time for people with their cognition, even people that didn't have memory impairment. And that was directly due to the isolation and the high stress at that time. It wasn't because, their disease was progressing. It was because the entire environment changed and people were, really suffering cognitively from lack of stimulation. So the brain is a very social organ, and isolation, it increases stress hormones, inflammation, um, and so many other things too. But we really find that when we add a supportive community of people that have been through similar things, and create a sense of safety, then the brain can relax and learn and respond much better because none of us are experiencing this in isolation. Everyone who's here on the call has been touched in some way or another by either dementia or cognitive issues. And the key to healing as a society is to have this level of connection. So that's why we really wanted to have a group where people can ask questions, rely on each other, and also feel less alone.
That's so important. You know, we're all having different experiences with what's going on globally. And just to digress a little bit, I feel like it's important to have community and to build community, as Dr. Jessica said, that's built upon connection. Safety is a big one because I feel a lot of people don't feel safe right now. And safety and brain health, there's a relationship between them, feeling safe. So having community that you feel safe with, that you can be vulnerable with, that you can share with is very, very, very wonderful for brain health, but also for our souls, right? We're also here there are a lot of things we can do with our time, but we want to be nourished. So I'm going to take the next question. The next question is this only for people who are worried about Alzheimer's disease? And this very simple answer is not at all. Many people are wanting just to be healthier. This is a longevity protocol. It's a joy protocol. It's a way to get to know yourself better protocol. Many people join BrainSpan because maybe they have brain fog, or they have burnout from stress or from parenting, or maybe you haven't slept well, or maybe you're needing to build stress resilience and you're wanting to work on all of the drivers that help us build our resilience to stress are also good for your brain. And those of you who've heard my talk on that will know there's a very strong relationship with building stress resilience and building brain health. So Alzheimer's prevention and treatment is just one lens, but it's certainly not the only reason people join our program. Dr. Jess, do you want to take the next question?
Okay, so what will participants actually walk away with? Well, I'm guessing that the participants will be walking more, for one. So that's probably a direct impact of our recommendation to generally walk daily. Um, Probably we'll start some strength training. Probably will, make some changes nutritionally. Most people, I think, once they realize how neurotoxic sugar is, most people start to reduce refined sugars. And that's kind of a first step, I think, for brain health. And then there's a huge continuum there. You can really, dial that in for nutrition. So also, we're going to have a course on a platform to where you can come back to the lectures and we'll have other resources up there. But we really want it to be a living resource for you to return back to. And so you'll get community. We are planning to have the sessions be always on Zoom, but three of the sessions we're planning in person. So for those of you that are local, you can come to the clinic, and that'll be really nice. So we're planning that for alternating sessions. So the first, the middle, and the end session, I believe, will be both mixed in person and also Zoom. So also, if you're not able to attend, that's fine. Or if a session doesn't work for you for your schedule, it'll be recorded and online to review. Any other things you think? I think probably what you might find, and this is what I've found personally as I have really studied this material, is a great deal of comfort and clarity knowing that I'm doing what I can to prevent getting Alzheimer's, which runs in my family too. So for me, I'm very motivated, as I'm sure most of you guys are, because it's really worth preventing that condition. It's one of the most difficult, and expensive and devastating medical conditions that I've cared for.
Yeah, really. Let me just check the chat to see if anyone else has asked a question. No. Don't hesitate to put your questions in the chat. We're also going to have some time just if you want to speak. We'd love to hear your voices.
I see one here from Brenda.
Let's see.
It says brain safety and stress resilience makes me think of my 35-year-old daughter who's working through a bipolar 1 diagnosis and meds. Would this be for her as absolutely.
Yes.
Would this be for
Great.
her as well to help her brain health and nervous system health? Yes. I
Yeah,
don't know if
thank
you want to
you.
answer that,
Good. Yeah,
doctor.
no, that's perfect. Thank you for asking that question. People who have depression, anxiety, bipolar illness, people who really, there's this very intimate relationship, right, between mental health and brain health. If your brain is not well,
Mm.
then your emotional and mental health are not well either. And it goes the same way. So many people who have depression for long periods of time tend to get dementia. So there's a very strong relationship between mental health and brain health. And I encourage you to let other people know that this would be a very good program for anybody interested in brain health, right? Or emotional well-being.
Well, yes. And I think the common underlying driver, Dr. Eileen, in addition to what we talked about, is metabolic health.
Right.
And there's a whole field now of metabolic psychiatry, which is very similar and overlapping to the field of, dementia treatment and reversal.
That's right.
And so there's very much commonality. And I think one of the things that's really blown me away as I've learned more about the brain is the spectrum throughout life that with children with brain issues and mental health issues, it's frequently inflammation, nutritional toxicities that contribute, and that's often the same situation for people with dementia or Parkinson's. And so, what we see in young people may look different. It may look more like ADHD or, depression or OCD, but that's a marker of that's how the inflammation is playing out in young brains versus older brains.
That's right. And I think what Dr. Jessica is really alluding to is many of the drivers of chronic illness are similar. So this approach is a good health giving approach. And we approach it that way as well. Do you agree with that?
Oh, yeah, absolutely. And also, I just wanted to share this resource that I shared with you yesterday, Dr. Eileen, this book, the Gut and Psychology Syndrome book,
Right.
by Dr. Natasha Campbell McBride. This is a really amazing exploration of how the gut and the brain are connected, and how, a leaky gut leads to a leaky brain and how that can contribute to brain dysfunction. But this is a really great reference if, anyone's looking to explore more about the field of, gut-brain health.
That's right. So something we didn't talk much about, but we're going to teach you a little bit about cognition in this course. We're going to teach you about how your brains work, which we alluded to. maybe some of the neurophysiology, but we're also going to teach you about your thinking. So you learn more about the different areas of thinking that we each have, the different types of learning and memory, attention and focus, visual and spatial, and also we'll teach about perception and sensation, because it turns out that how our senses are working in the world impact the health of our nervous system, but specifically relate very much to the information that our brain is either acquiring or not acquiring. So there are ways to optimize our, sensory system and perceptual system. Should I go on to the next question though, around brain span? This is primarily, the question is brain span a medical treatment? So our course is not a medical treatment, but it's an opportunity to empower you. It's an opportunity to empower you to learn and to implement into your own life changes that you may have desired to implement based upon your learning. But it's also an opportunity to have questions to go back to your medical providers with, right? And a lot of the education that I do, I'm giving people questions to ask their providers. So you get a lot of information about how to be a self-advocating brain health patient or client. So it's really an educational program. So we're not going to be diagnosing, we're not going to be curing diseases. It's not that type of program at all, but it's a program that's based upon a health-focused model that gives you a lot of information about how to improve your own health and how to ask questions. So it's very complementary to any medical care you might be getting. And our encouragement, of course, is just to keep going back to your Medicare providers with information like, I didn't know what homocysteine was, and I didn't know that maybe my level should be a little bit lower when it comes to brain health. So then you have something to talk to your physician about or your care provider. And
Well, and if they're not able to really dive in to this work with you, Dr. Ilene and I are. We're not trying to, I don't know, see every patient in the world, but if you need us, we're here for you. We see people in Colorado and some people come from out of state. So what's nice about this program is that it can be anywhere and all that. But in order for us to order labs or studies or all that, that would be a patient-doctor relationship.
that's right. But we serve as consultants all over the world, right? We're educating and consulting all over the world, including New Zealand for me. That's my farthest.
Yeah, I don't have anyone there, but that
Ah,
sounds fun. I have to go visit, I think. Maybe do a house call.
do that. Visit with some sheep.
Um, all right, so we've just got a couple more here on our list from the others, and then we'll open it up if there's any more. But so the question was, how much time does this take each week? So we are going to have sessions every other week. But the weeks that we don't have sessions, we'll have content and other recordings and homework. You can, take it and at the speed that you like. Some people might decide they want to do everything in the front end, and then, or you might want to take your time, and even after the sessions end, you'll still have access to the materials too, so you can study them at your leisure. So we really want it to be, not a stress to you, but something you look forward to that, is not more on your plate, but fills your plate, with nutritious content.
That's right. A lot of nutritious content.
Uh-huh. Um, yeah, so the reality is that really small shifts can have a huge impact. And so this isn't something, perfection is not the goal. The goal is to, kind of take it at your own speed, and make steady progress.
We have a little bit of time. I have to give you a very sweet example of you can enter at any point. And that's why BrainSpan Bootcamp is really for everybody. I have a wonderful patient in Canada. I'm from Quebec myself. Healthcare there isn't wonderful. It's just really not. It's hard to get into specialists. And so someone from Canada approached me about 5 years ago, and they were involved with a really amazing hospital in Montreal that have a great memory clinic. But they were just, it was a diagnose and adios situation. So they contacted me, and the person had been diagnosed with mild dementia of the Alzheimer type. And they contacted me and said, "Is there anything you can do?" And they just couldn't get any of the labs. So it was and they didn't have money actually. So it's a great example. And I have a video of them, which I might post. I have permission to post it. So I worked with them without doing any big labs, just some very simple things, and lifestyle changes. And so that was their entry point. And having just changed the sugar that Dr. Jess talked about and changing his sleep because he had sleep apnea. So just correcting about 3 or 4 of the lifestyle pillars made him an unbelievably successful reversal story in this big medical center. So this man was the only man in the study who did not show any decline, but improved after 5 years. So for some patients, it's going to work that way. We have absolutely no assurance that it will happen for many or most that way. This gentleman was lucky. He's in his 80s. We started when he was in his 70s. So do you know what I'm saying? It's like you don't always need, and if you can't get the most complex labs, we work with you there as well. Is that right?
Yes, absolutely. And definitely age is not a barrier either. I have many patients in their 90s who are sharper than I am. So not to be ageist at all, it's, open to anyone at any decade.
That,
Um, yeah. So that's really cool and inspirational for me to know some elders who have done everything right and are an incredible inspiration. But even them, that's a huge focus is maintaining independence, maintaining their projects that are so important to them. I'm just thinking of one gentleman in particular who's 96 and he still publishes and speaks academically and travels, but he notices some issues. And so everyone can make brain health their focus.
that's right. And benefit in some way,
Yeah.
right?
Yeah, okay. So the last question that we had from our list was what is the next best step? You want to take that one, Dr. Rusk?
Here. So the next best step for you guys is ask any more questions if you have any more questions. And if you'd like to and you're curious, the best way is just to stay engaged with us. Notice what resonates, and you're welcome to sign up for the boot camp. We're going to have time for questions and answers right now. And you can also contact us with questions and answers, but our brain health boot camp is going to start the 25th of February, and we're really looking forward to any of you who want to sign up. That would be great. What do you think?
I just want to say again that brain health is not about fear mongering. It's not about, delaying really and waiting for things to get worse. It's about supporting the systems of the body and then supporting each other too in a community. And your brain matters to us. And we care about it now and we care about it in the future. And we're here to support you and to cheer you on. We believe that now's the time to start, and we really thank you for showing up, and really hope that we can work with you.
That's right. Thank you for being here. This is a program about joy in addition to being about brain health. And if anyone has any questions, we'd be so happy to take them either in the chat or you can raise your hand. And if you don't, that's okay too. Stephanie, you can unmute yourself.
I just did. I have to leave in 2 minutes for a client, so I just figured I would just thank you for this. This is helpful. I'm going to sign up. And how many people will be in the class? Is there a limit to the
That's
number of people you accept?
The only limit we have is related to how many people can be in our office. So we will limit the number of folks that come in person. And I think we can fit somewhere between 12 and 18. So we'll see. But I don't expect that everyone will be available to come for the in-person. So we'll see how that goes.
but
Okay.
you'll be on the in-person list, Stephanie.
Okay.
Thank you for being
Thank
here.
you. Thank you. Looking forward to it.
We are too. Brenda,
Yeah, maybe you could get back to me, but how I could sign up as a caregiver, just let me know if you want to email or text me, or so I'll do that with my husband and then I'll check on my daughter.
do you want to put your email in the chat then?
Sure, you bet.
So one thought would be sign up your husband, and then you have the same login, you have the same credentials and things. Maybe that would be, and Dr. Ilene and I will sort of hash out sort of those specifics. But I think that that's one option for people that live together, is to have the same login. So we still have 4 weeks to really kind of figure all that stuff out.
And in the
Okay.
other brain health, Brenda, just to answer your question, we've had great success in the other brain health coaching groups that I've done with just two people being on the same screen. There's no
Mm,
feedback. You have the same login. It's totally fine, you know,
Okay.
and it works really well.
Okay, awesome.
And
Yeah.
it's really about your relationship too, what you're most comfortable with, because some people do prefer to be in another room, and that's fine too. We can work
No,
with those.
yeah, no, that's great. He and I talked last night and this morning when we saw this again and said we'll like to do it together. So we'd like to figure that out. That'd be awesome.
That's beautiful. And you know what? It's good for the care partner and it's good for the patient.
Yeah, it's true. Thank you.
Hi, Stephanie. Thanks for being here. And thanks for your email address in the chat.
Okay.
I'll send that to Dr. Jess and to I. And Jen, did you want to say something? We're so happy you're here.
Thank you. I was just typing something out. Thank you so much for hosting this. I am super excited, and I think that I'm going to be able to participate because Wednesdays is like my non-office day. And so that time slot was like perfect. That's why I was like, I'm gonna join so I can like hear when and the progression. So I think I can join.
We're very excited.
Yes.
That's a real honor too, because you're in this field. Maybe you want to say a little bit about you and what you do, but I mean, that'd be really, an honor
Yeah, thank
from my
you. Well,
perspective.
I would absolutely love to continue my knowledge and learning from the two of you. And yeah, I have just the utmost respect and love for both of you.
I know that we feel
Yeah, always learning, always growing in my knowledge. So anything I can do to help support my own brain health and then carry that into the world,
that's great,
I'm here for.
which you do very gracefully.
Yeah, well, thank you.
Okay, good. We look forward to having you. Okay, Brenda, I have your email address. Thank you. Any other comments or curiosities? Anything, Dr. Jess, that you think we missed or that you'd like to say?
No, I'm just really so excited. I started this not only for my mom's brain health, but also for my own. That's why I went into private practice, was because this was my top focus mission. For me, I've been in a group like this of other doctors through TrueNeura. And what I didn't expect was how powerful the community aspect was
That's
of
right.
that group. And so that was the motivation for having this, because I really want to share that particular, very missing and very relevant part of healing.
That's right. And the reason why I started this work was really my own fear and having seen the relationship between um, emotional health, a feeling of happiness and comfort and safety along with brain health. Plus, just as a very young person, I was determined to find a cure for Alzheimer's, and that was probably in my teens. So, I mean, this passion has really continued. And as we all know, being in a loving, caring community that's focused on health is is the way to go right now. So, Brenda, you have your hand raised, and I'd love to answer your question.
Thank you. Sorry, one more. I meant to look up that True Neura that you're talking about, and I haven't had a chance yet. What exactly is that?
That's a good question. Yeah,
Sorry, I'll answer that one because
great.
this is something that I've really been working with that company over the past year to roll it out for people who are wanting to track. So TrueNeura takes in and integrates biometric data like Aura rings or Whoops, continuous glucose monitor data. For my patients that are reversing cognitive disease, we do so much lab testing and then we monitor it over time. So it's really helpful for looking at trends and graphing things. It also allows me to enter in cognitive testing, MoCA, CNS vital signs. And what is nice is that it provides a view, like a whole view, overview of all of the metabolic and other factors in a way that patients can kind of visualize and understand. So all of the root causes of dementia are in a nice screen that you can see. So this is great for, showing people how far we've come. Some of my patients that now we've been working for 9 months together, we see incredible trends, reversal of insulin resistance, homocysteines corrected, toxins going away. And so scores can change and improve. And so that really helps, I think, people know that they're on the right track. It also helps to look and see what we're missing. But Dr. Ilene and I were on a case presentation just today, this morning, of me presenting one of our shared patients. And that community has been a real wealth of education and resources. So for me, it's been a mastermind where I can present my cases to Dr. Christine Burke, who's one of the chief investigators for the EVANTHEA trial. So the way they've set it up is basically to affect the EVANTHEA trial on a larger scale. So those are all the markers that are being followed, and so I love it, except that they're about to release a version 2. Version 1 has been onerous for me to get it going, and so I've only rolled it out for a couple of people. But once version 2 is available, then I'll be offering it on a wider scale. As part of the BrainSpan Bootcamp on my website, if you look, there is the option to add on TrueNeura during the experience, and I think that it's about $50 a month. If that's something that someone wanted to use, there's ways for me to integrate your data without being my patient. But if you wanted me to order labs and do testing, then that would be more appropriate for someone that's seeing me as a patient.
Mhm. And I can't overemphasize the value of having True Neura as an organizing principle. Because remember, before there was True Neura, there was my clinic, and it was very hard to track. There are so many pieces of data that have to go in different kind of orders and stages. And what Dr. Jess is doing is really organizing and giving you a visual with True Neuro that makes it much more palatable and easy to implement and see change over time. So that's the beauty.
The other thing that's cool about it too is that I can enter in different protocols. So, say, well, one of my guys, when he first started seeing me, he wasn't drinking any water at all, and he was dehydrated and he was hypotensive. So, setting up timers and reminders, for water drinking, you can customize it for timers and reminders for supplements and medications, or if there's other goals like 3 days a week you're doing weightlifting, then you can put that in there too. So there's some accountability, and then there's some survey functions in there as well. I think it's really going to be a great product once we get all the kinks worked out. So.
But you're really, it's you do it. You do it beautifully with the patient that I've seen. It's fantastic. There's so much valuable data.
There's a lot of valuable data. It's just a little hard to put it into the program. So I've had to have some support staff, and that's working. But yeah, we're working out the kinks. So even maybe by next month, it'll be more ready for go time.
So just to review, there are many ways you can enter this program. There are many ways you can enter working with us. You can start very simply with working on lifestyle factors. You could take deeper dives into old infections, insulin resistance, mold, toxins. So, really everyone's welcome. That's the key. So we hope to see you and be in touch with us. Do you all have our contact information? I suppose you do. I'm just going to put it in the chat. Which email would you like me to put for you, Dr. Jessica?
I'll just put it in myself too. I'm going to give everyone the info for my clinics so that if I'm seeing patients, it'll go to someone who can help you right away. So this goes to one of my assistants here. And then my website, and this is where, at least for now, we have the sign up. We'll get one on Dr. Rusk's site too for, signing up for BrainSpan Bootcamp, or you have that there?
It might be on already. So
Okay.
I'm going to give you the other one too. It's healthybrain.clinic. And that's the Brain and Behavior Clinic. So we're housed within the Brain and Behavior Clinic.
And then we'll just keep having content that we're going to put up on YouTube, Facebook, Instagram. Follow us and let us know if there's something in specific that you want us to address. But in the meantime, we'll be really enjoying putting all of this curriculum together. I'm so excited that there's a couple of you that are going to be with us, and it's going to be fun. And I just can't wait to get started.
I'm so excited. So thanks for coming today. Let us know if you have any extra questions, and blessing you, your health, and your brain health specifically. Bye, guys.